Welcome everyone to this video on the diagnosis of ego states. This video is intended for advanced learners of transactional analysis. So there are experiential exercises. Please do the exercises for best learning. At the end of listening to this session, you are expected to be able to differentiate between the structural and functional ego states, identify the 4 levels of diagnosis of ego states, identify the 4 behavioral aspects of diagnosis, describe the postural characteristics of each of the ego states, identify at least 3 specific vocabulary used by each of the ego states, and you will also be able to listen to and differentiate your own voices from the 3 different ego states, between the 3 different ego states. When Byrne uses the word diagnosis, he is talking about diagnosis of ego states by the therapist and not the mental health professionals like psychiatrists making clinical diagnosis of conditions using DSM criteria and ICD-10. The process of diagnosis is specifically intended by the work done by a therapist on the client. As students of TA, when we learn the word ego states and diagnosis, we may practice it on ourselves. That is all right, but here please keep the focus on therapist diagnosing clients. Byrne describes ego states from structural and functional perspective. Structural perspective is based on what is the message that has gone in and what is the responses to the message that has been developed in the various ego states. This may include the structural content identified at first diagnosis or later in the second order and third order diagnoses as well. Higher order structures we'll discuss within later in another video. Functional perspective is about the behavioral or existential functional expression of persons. As you can see, it depends on the behaviors, and different aspects of the behaviors are helpful in making functional diagnosis. For structural diagnosis, we need deeper interviews. When we say levels of diagnosis, there are 4 different levels of diagnosis. Of this, first is the behavioral diagnosis. Behavioral is the easiest to identify. Since ego states are named using simple words like parent, adult and child, observation of parents at work, socially effective adults at work, and children at play will help us to understand the behavioral characteristics of each of these ego states. This is not a foolproof method. This is not a complete identification method as well. But this is a good place to begin with. Some ego states in different persons may have different expressions, and some ego states of the same person may have similar expressions also. That is why it's not a complete method. Social diagnosis comes as the second method of diagnosis. It comes through the thorough knowledge of type of transactions that Byrne has described, transactional responses and rules of transactions. It will make possible social diagnosis of ego states. This happens when the practice of ego state diagnosis and structural diagnosis becomes integrated. To some extent, social diagnosis is possible in our self-analysis and the analysis of the people who we interact with. The next 2 levels, the historical and the phenomenological kinds of diagnosis, are possible only in clinical situations. Historical diagnosis is a combined thoroughness in structure, function, and historical events are important in making a historical diagnosis. Phenomenological diagnosis is a word used by Byrne in a very specific sense. That is the phenomena of the fixation of the child ego state, which may have happened early in life, and the bodily experiences associated with it and the emotions all become available together at some point in therapy. That's when the phenomena is recreated. That's what he means to say phenomenological diagnosis. So as you can see, there are 4 levels: behavioral, social, historical and phenomenological. What we commonly do may be considered behavioral. Little more depth in function and the process happens in social diagnosis. And when you add the history also, we get the historical diagnosis. And when it is recreated, it becomes a phenomenological diagnosis. The characteristics of behaviors are generally listed as postures, gestures, facial expressions, vocabulary, and the sound. Each of these is very different in different ego states. Even in the same ego state, some of these things may be different. So we need to have a close understanding, a deep understanding, and a close watching of people to learn this. Behavioral clues for each ego state. As discussed previously, behaviors are visible and hence easiest to identify. Behavioral clues of the ego states are general patterns. It is a good place to start the diagnosis process. They are functional expressions of the ego states. For a thorough diagnosis of ego states, deeper interviews are required to decipher the contents of the structure. When it comes to historical and phenomenological diagnosis, it is at structural level. Now here you can stop the video and do this reflective exercises so that what you have heard comes back to you and it gets processed inside you. Now let's look at some general ideas about behavioral diagnosis to begin with. Now let's look at some postures. You may think over if any one of these looks like a parent-like posture or adult-like posture that you're familiar with. Reflect in your thinking. What is the kind of power this person is exuding? Obviously here you are seeing children. So these are characteristic postures of children. But if you see a grown-up person sit like this, which ego state may be that? Look at these classical gestures used by persons while communicating with others. Reflect on whom are you reminded of when you see these gestures. Any of your parents or teachers or anyone who uses them. Here you can see some expressions named after the emotions expressed. You may reflect on which ego state may be expressing each of these. How often do any ego state express any one of these expressions? Here you can see list of commonly used words and phrases from parent ego state. You may not agree or you may agree with them, but that's okay. Reflect whether this brings to your mind your own awareness about your own ego states or any of your parent figures. These are a list of commonly identified words and phrases used by adult ego state. You may or may not agree with this. That is okay. Reflect whom are you reminded of. Here is a list of commonly identified words and phrases used by children and the description of their sound and tone. Whether you agree with them or not, think of situations where you yourself sometimes get into these kind of usages and sound. By now you are aware that diagnosis of ego states is very individually specific. Now let's go through some exercises. For each of those exercises, you may stop the video, finish the exercise and then proceed. Stop the video. This exercise is an attempt to recapitulate your parent ego state, or you can draw a caricature of your parent ego state using the postures, tones, gestures, words used, etc. This exercise is to help you to identify how you present with your adult ego state. Look at the posture, gesture, etc. Try to draw it in a caricature and capture the sound you use and the words you use when you use your adult ego state. Now attempt to recapitulate your child ego state with the postures, gestures, vocabulary, words, and your facial expressions. A thorough knowledge of types of transactions, transactional responses, rules of transactions, and their relation to ego states only will help make possible a social diagnosis. This happens when practice of ego state diagnosis and structural understanding of the ego states deepen. Here we can see two instances of social diagnosis. Depending on which ego state of the other is responding to you, you can diagnose your own ego state. Your awareness of your own ego state in response to a given stimulus from others is also possible. You can see that in the next slide. Look at these examples. If you become aware of your child ego state in response, stimulus from the other may be coming from the parent or the child of the other person. So also, if your parent is being stimulated, the stimulus may be coming from the child of the other. If you feel that your adult is responding, the stimulus may also be coming from the adult ego state of the other person. A historical diagnosis is possible only in a therapeutic or counseling situation. To make historical diagnosis, therapists are required to have a combined thoroughness in knowledge of structure, function, and transactions, as well as a capability to elicit history from the client. The word phenomenological is used by Byrne in a special sense. That is the phenomena of the fixation of the ego states which may have happened early in life. This becomes available during therapy with all the bodily experiences, emotion and responses. This is available for introspection. This is made possible with specific skills of the therapist and thorough preparation of the client. Once this happens, therapy is practically half done. Thank you for listening to the video and doing the exercises. If there is any concept that you need to understand further, please go back and listen to the video.